Welcome to Thursday Thought Leaders with Harbinder Narula on BW Healthcare World. My guest today is Mr. Hirak Bose, who's the Senior Vice President of Sales and Marketing at Lupin. He spearheads Lupin's respiratory, anti-TB, and the pharma divisions. Hirak is passionate about business transformation and pharma marketing and is a frequent guest speaker on leadership and pharmaceutical marketing at the esteemed institutes as well. Let's speak to Hirak Bose on understanding what Lupin's business looks like and what it would look like in the next 5 years. Welcome to BW Healthcare World, Hirak. It's such a pleasure to have you with us this morning on this Thursday Thought Leader show. Before I move ahead, you spearheaded Lupin's respiratory, anti-TB, and pharma divisions and have successfully advanced the respiratory division with notable achievements. My question to you is, in what manner, in terms of detailing, did you work on the respiratory division whilst holistically spearheading various other divisions at work? How did you focus on this one area as a leader?
Thank you for this opportunity to interact with you. The journey of spearheading Lupin's respiratory and anti-TB business has been both challenging as well as fulfilling. To achieve advancement in the respiratory arena, we had to balance multiple portfolios and outline a strategic, patient-centered approach to ensure we achieve our vision. Some of the key areas we focused on to advance the respiratory business have been, first and foremost, a patient-centric approach. We focused on understanding our patient needs, highlighting the need for awareness. This enabled us to provide medically verified resources for respiratory health and offer individual and personalized guidance to the patients. Then, diagnosis at scale. Recognizing that early diagnosis is critical in respiratory diseases, we launched an initiative called Heal Thy Lungs. With the help of SCPs, we screen over more than 600,000 patients annually. This initiative has really helped us to raise awareness and enable early detection of conditions like asthma and COPD. The next was adherence to the therapy. We saw that most of the time people doesn't adhere to the therapy. And the research shows that 90% of the patient in respiratory cannot take their inhalation device correctly. To address this, we launched India's first digital asthma educator program called JAY, Joint Airway Initiative, which trains patient on using the devices correctly, thereby improving adherence to the therapy. Then it was, of course, the innovative product launches. Our emphasis on innovation has resulted in introduction of many first in India and first to world respiratory product and devices. Our focus on the patient's journey from awareness to diagnosis to adherence has been instrumental in achieving sustainable growth. The goal is to redefine healthcare for respiratory patients by providing products and holistic solutions that improve lives while ensuring sustainable business growth. Our success as a company lies in multi-pronged strategy that combines strategic sales and marketing, business development, product innovation, and team leadership, all underpinned by a patient-first philosophy.
That's fantastic, Hirak. But where does Lupin stand in today when it comes to respiratory products? And what is your vision and mission to take it from where we are today in the next 5 years?
The mission for next 5 years is to impact beyond business by empowering patients to ensure patient can access accurate information, timely diagnosis, and effective therapy through groundbreaking initiatives. Advance innovation to introduce more and more innovative products, focusing on simplifying device usage, improving adherence, and enhancing treatment outcomes. Expand reach to strengthen our presence in emerging and underserved markets by building robust respiratory and anti-TB portfolios tailored to local needs. Enhance sustainability to lead the industry in developing eco-friendly inhalation device, reducing our carbon footprints while staying committed to environmental sustainability. Talent development has been one of the most important area for us. So we'll invest in talent development to build industry's most innovative and patient-focused workforce. Empower our team of 1,850 to spearhead new initiatives while focusing and fostering a culture of ownership, agility, and innovation. Focus on cost efficiencies and process innovation without compromising patient outcomes. Success to us is measured not just in numbers, but in the quality of life of the patients who have improved disease diagnosis early and stay adherent to the treatment. It's about creating a global respiratory ecosystem where healthcare isn't reactive, but proactive, personalized, and all but accessible to all the patients across. With this vision and mission, Lupin will continue to lead with innovation, empathy, and a steadfast commitment to improving lives.
And Hirak, you were in your conversation, you have just focused on patient centricity. You've spoken about your workforce, young people. You've also spoken about innovation as a culture. All of these today, if you look at it, is related to younger people coming on board. They're people, patients who are more, aware. The workforce is becoming younger and younger, and that is also leading us to innovation. What would be your message to the youth of today that Lupin or you are dealing with when it comes to work?
Excellent question. For today's youth, I have a simple yet powerful message. Dream big, act purposefully, and never lose sight of the impact you can have on the world. I think here are a few guiding principles which I follow and I would love them to also follow. Be passionate and purpose driven. Find a purpose that fuels your passion, whether in healthcare, technology, or any other field. Channel your energy towards solving meaningful problems that makes a difference in the people's life. I will also suggest them to embrace innovation and learning. The world today is evolving rapidly. So stay curious and be adaptable. Be open to new learning, skills, embracing technology, and challenging the status quo to create groundbreaking solutions. Value empathy and collaboration. I think authentic leadership comes from understanding others. Work collaboratively, respect diverse perspective, and always prioritize the greater good in others. In healthcare, for example, every innovation we create is rooted in the empathy for the patients. The other points will be resilient and patient because success isn't a straight path. It's a journey filled with challenges. Learn from your failures, persevere through tough time, and remember that every step forward, no matter how small, brings you closer to your goals. Think globally, act locally. The world today is interconnected, and your actions can have a ripple effect. Start by making a difference in your immediate environment while keeping a broader perspective on how you can contribute globally. We should all commit to sustainability and responsibility. As stewards of the future, prioritize sustainability in everything you do, whether protecting the environment, supporting health initiatives, or driving ethical innovation with the aim to leave a better world for future generation. You all have immense potential to be the agents of change. Whether you aspire to lead, to innovate, or create, remember that your work should aim for success and significance. With focus, determination, and compassion, you can build a future that inspires others and uplift humanity.
That's awesome, Hirak. And you spoke about leadership. Let me bring the conversation towards leadership. We've seen that Lupin has been a very successful organization, and it has acted little differently from other pharmaceutical companies. So, what has been the key to Lupin's success? How is it that you have driven it as a very different organization compared to other pharma companies? And what has been the differentiation when it comes to SOPs that you have created or the leadership models that you have inculcated within Lupin?
Wonderful question. Thank you. Lupin is a leading transnational pharmaceutical company and it plays a vital role in contributing to the health and well being of people. In Lupin, people are our biggest strength. At Lupin, we foster an environment that encourages the growth and development of our people. At Lupin, our core values remain a cornerstone of our growth and success. Every Lupinite embodies and exemplifies our core values of teamwork, passion for excellence, entrepreneurial spirit, customer focus, integrity, respect, and care. We uphold these values, making a remarkable impact on Lupin's culture and business, and continue strengthening our foundation and building a brighter future within and beyond our organization.
And before I move to the next question, Hirak, what has been your leadership mantra? I mean, you've spent a lot of time in the pharma sector, and you're also very, very. I know that you are very, very, uh, you know, uh, engaged in sharing pharma marketing insights. What has been your leadership mantra when you're managing your teams within Lupin? What have you mastered, and you feel that has worked really right for you?
So, so if I have to talk about that, uh, I will come to the Lupin values. But out of those values, each and every Lupinite has imbibed these values in and out. So we practice the core values in and out every day.
Awesome.
These values are the guiding principles for us as we go on doing our business. It's
Aw-
at the core of the heart. And to me, I think practice all the values, but if I have to talk about one which really touches me among the six is respect and care. We should value our people. We should give respect to them. And I'm sure they will respect us 10 times more.
That's a very powerful message, Hirak, because respecting your workforce and the work that they do is extremely important. And the other message that I got from when you said that every Lupinite is aligned to the values, it's about aligning the corporate values with the personal values of the people who are involved and engaged in the organizations. That's very beautiful. Now, what is Lupin's motto when it comes to affordability factor? Because I truly believe that there are three or four aspects which are the pillars of healthcare. One is accessibility, second is the quality of healthcare, and third is affordability. Now, there are two segments in the healthcare industry which play a very important role. One is the hospital and the doctors to create the access as well as the quality. But when it comes to affordability, there's a role that pharma sector plays. So, what is Lupin's motto to focus on affordability as a factor?
Yeah. Lupin believes in healthcare for all. That's a very, very strong statement I'm making because it's from everybody. The ethos of this we inherited from our founder, Dr. Deshbandhu Gupta, who believed that science can be a potent catalyst for change and transformation. His conviction in the power of science to improve health outcomes and uplift communities continues to serve as a guiding light for us. This helps us ensure accessibility remains deeply rooted in our mission to improve lives globally. Now, affordability, which is one point you have asked me also, I think compared to the global scenario, Indian medicines are very, very affordable. And we always work to make it much more affordable. But accessibility, if you see, because of our distribution system, we reach each and every pin codes of India. So our products are available at the nooks and corners of the country and are accessible by all.
Fantastic. And Hirak, lastly, uh, at your esteemed position, I mean, you're a leader in the organization, and your thought process can really drive what Lupin does as far as the divisions that you're managing. What changes that you feel you can make in spreading awareness on behalf of Lupin? Because when you're looking at respiratory products, that particular division today, pollution is a very big issue that we are facing in the country. As a socially responsible pharmaceutical organization, what do you think you can do to spread awareness, spread care on behalf of Lupin while you're in a position to do that?
So basically, you see, it's not just me. I think every Lupinite is a torchbearer for the organization. While each of us does their part, I have the privilege and responsibility to drive impactful initiatives that amplify Lupin efforts to spread awareness. At Lupin, spreading awareness is not just about creating campaigns. It's all about building a sustainable ecosystem of knowledge, empathy, and accessibility. By combining innovation with a deep understanding of patient needs, we can empower individuals to take control of their health, reduce disease burden, and ultimately transform lives. Through strategic partnership, educational initiative, and leveraging advanced technologies, we aim to reach wider audience, ensuring that our message resonates and leads to positive health outcomes for all. Now, coming to the pollution which you talked about, uh, you understand as an industry, we cannot really control the pollution other than following all the sustainability steps. But we really work on plantation. During the World Asthma Day, we planted more than 10,000 plants across India, which really helps. for a better year. Today, I think everybody has to have the right to breathe the right air. So one of my suggestion to everybody in India is, can we all plant one plant during our life? I think will make a big difference to the air we breathe in.
That is actually a very good message because keeping in mind the population of our country, even if each of us plant one tree in our lifetime, we would be making a difference on the life of the future generations that are going to be living on this planet. Hirak, thank you so much for this conversation. There were a lot of things. I mean, I like the focus on patient centricity because if you as a leader is focused on patient centricity, I think you will be able to drive the organization towards that. And the effort that Lupin is making in terms of early diagnosis, especially when it comes to awareness creating for asthma and COPD, could actually drive to a little healthier population when people start taking care of it on their own as well. I mean, early diagnosis can actually help in getting better care when it can really make a difference. Second thing that you brought up was very, very important because that is where most of us miss is that it is not about just having the therapy available. It is not about just having the medicines available or the care available. It is the adherence that makes a lot of difference. When people are not able to adhere to the dosages or to the proper use of the therapies that are there, the equipment that is there, they lose out on the benefits that they can derive from that. So I think adherence is something where we need to really create education among people, awareness among people, and this is something where the industry needs to come forward and take the initiative. And third is, it was very beautiful to note when you said that we are not just focused on creating stuff for India, we are also looking at creating the initiatives which could be the first for the world. Now, that is the vision or the mission that can actually drive the growth that India needs as on today. Uh, and looking at the younger people when it is their focus is on quality of care, patient safety, etc. And I think that is where also the awareness could make a difference. And I loved when you said, and as the last thing, that your message was dream big and act purposefully, because that is what every healthcare worker needs as a mission in their minds today. So thank you so much for speaking to us at BW Healthcare, Hirak.
Thank you very much for giving us this opportunity to talk. Thank you.
Take care.